Thanks, Stephanie. So welcome, everyone. This is great to see all of you in person, or just about all of you in person. So I think this is the first time that I've been presiding over this meeting since I started here 2 years ago. So yeah, I'm the Chief Deputy Director, and I think Vince has been doing this, but Vince did retire 2 weeks ago. So just wanted to let everyone know that. And so I guess until we have a new person for Vince, I'll be presiding over these meetings as well. So with that, I guess I'll get into introductions, and I'll start with Carl, who is remotely attending.
I'm Carl Craner, Distinguished Professor of Philosophy and a member of the Environmental Toxicology program. I'm very sorry to miss this meeting. Sounded like a lot of fun. I'll observe as best I can. I was diagnosed with COVID yesterday.
All right, Laura.
Hi, I'm Laura Cushing, Assistant Professor in the Department of Environmental Health Sciences at UCLA.
Tom?
Okay. Well, I'm Tom McCone, Professor Emeritus at the School of Public Health, University of California, Berkeley, and also a retired affiliate at Lawrence Berkeley National Laboratory.
Ulrika.
Hello, my name is Ulrika Luderer. I'm a professor in the Department of Environmental and Occupational Health at UC Irvine.
Jenny.
Hi, my name is Penelope, nicknamed Jenny Quintana, and I'm a professor of environmental health in the School of Public Health at San Diego State University.
I'm Meg Schwarzman, and I'm a researcher and lecturer in the Environmental Health Sciences Division at School of Public Health, UC Berkeley.
Oliver.
Oliver Fien. Is that on?
Oh, it's on. Oliver Fien, professor at Molecular and Cellular Biology and Genome Center of University of California in Davis.
Jose Suarez, associate professor at the Herbert Wertheim School of Public Health at the University of California, San Diego.
All right, great. It looks like we have a quorum. So with that, I will turn it over to Meg to run the meeting.
I'm going to pass back to Dave for just a second.
All right. Great. So the panel last met on March 7th, 2023. The meeting did include updates on the Biomonitoring California program activities, including the community biomonitoring studies. Also heard from a guest speaker, Matt McLeod, professor of environmental chemistry at Stockholm University, and he presented on the application of a population-based pharmacokinetic model for interpretation of PFAS data from the California Regional Exposure Study. The panel, staff presenters, and audience members delved into planning for future program activities. The panel also provided feedback on current activities. Key discussion topics included the challenges and opportunities of assessing exposures to PFASs, including highly exposed subpopulations, and the use of California Water Board data to identify potential hotspots of exposure in California. The use of expanded PFAS methods to analyze samples from the California Regional Exposure Care Study, and the studying trends in exposures in prenatal steps study. And then complexities in messaging potential arsenic exposures due to rice consumption, and interpretation and future analysis of the data for urinary naphthalene in the Stockton Air Pollution Exposure Project, or SAPEP. The summary of the March meeting and transcript are posted on the March 23 SGP meeting page on the program's website at biomonitoring.ca.gov. All right, and then one other item, the also that Unha Ho resigned in July from as being a panel member to give more attention to her other commitments. She was appointed by the Speaker of Assembly in 2018 and has been an outstanding member of the panel for the past 5 years. We want to thank her for her service to the people of California and wish her the very best in her future endeavors. All right, I think back to Meg. Sorry about that.
Thank you, Dave, and good morning. Since I have a bit to say, let me just, is that good for closeness of the microphone? Okay. To just begin, for transparency's sake, I wanted to share that in September, I was contacted by Vina Singla of the Natural Resources Defense Council, and we discussed PFAS definitions in general, but not the work of this committee. And I suggested that they contact Biomonitoring California staff for more information. So as a reminder for panel members, please comply as usual with Bagley-Keene requirements that all discussions and deliberations of the panel need to be conducted during the meeting, not on breaks or with individual members of the panel on or offline, including via phone, email, chats, or text messages. So the plan for this morning's meeting, we will start with an update from the program on recent activities, including the program's extended method for detecting perfluoroalkyl and perfluoroalkyl substances in serum and plasma. The remainder of the meeting will focus on the SGP's consideration of the expansion of the PFAS designated chemical group, and that'll include an overview of the potential expansion of the designated chemical group document by OEHA. It'll include a public comment period and discussion by panel members. There will be time for questions from the panel and the audience after each presentation. So instructions for how we'll do this split hybrid meeting. If SGP members wish to speak or ask a question, just raise your hand and I will call on you. If online webinar attendees have questions or comments during the the question periods after each talk, then you can submit them via the Q&A feature of the Zoom webinar or by email to biomonitoring@oeha.ca.gov. We won't be using the Zoom chat function during the meeting. Please keep your comments brief and focused on the items under discussion. This is for the webinar attendees, and relevant comments will be read aloud and paraphrased when necessary. If online attendees wish to speak during the public comment periods and discussion sessions, as opposed to submitting a written comment, please use the raise hand feature in Zoom, and Stephanie Jarmal will call on you at the appropriate time. If you're attending in person and you wish to comment during the public comment periods and the discussion sessions, please come to the front here. We'll return a microphone to this stand, or raise your hand and I'll call on you at the appropriate moment. And for the benefit of the transcriber, a reminder to please clearly identify yourself if you're commenting from the public or the audience before providing a comment, and also write your name and affiliation on the sign-in sheet that's in the room, at the back of the room, I think. Okay, so we will start by hearing from two speakers from the program. I will hold off on asking for clarifying questions from the panel and audience until we've heard both presentations. So our first presenter is Nerissa Wu, Chief of the Exposure Assessment Section in the Environmental Health Investigations Branch, EHIB, of the California Department of Public Health, and the overall lead for Biomonitoring California. She'll provide an update on current program activities.
Good morning, everybody. Is there a way to... Great, thank you. Good to see everyone in person, most of you. Welcome to those of you who are joining us online. Today's update was actually initially designed for our August meeting, which then had to be delayed because of the hurricane, but we've edited it to incorporate some of the more recent activities. So there is a lot to go over, so I'll spend a little bit of time on some administrative updates before covering project updates and laboratory and communications activities. So We've had a lot of staff change. We've had a few people leave the program. Cheryl Holtzmeyer, who used to run this meeting, Sabrina Smith, who's been such an instrumental part of the environmental chemistry lab, and Andrew Tan, who helped manage samples over at the Environmental Health Laboratory. They've all left the program, so I just wanted to wish them well and thank you for all their work. We also have a number of new staff that are indicated in blue here. We have McKenna Thompson. We have Rebecca Biosa, who's helping run the meetings now, and Melton Musa, who you'll hear from later today. And we have one new staff person at DTSC, Ruhong Shao, and 3 interns who've joined us, Emily Blake-Lorian, Emily Gokin, and Sarah Snyder, all who have joined the program in the last few months. So welcome to all of you, and we're looking forward to working with you. And we also have 2 new staff who have taken on new roles. We have Susan Hurley, who you're very familiar with, formerly with UWIHA. She's now with CVPH, thankfully still with Biomonitoring, and Stephanie Jarmel, who you have just heard from, who is now the chief of the Safer Alternatives Assessment and Biomonitoring section. So congratulations, Stephanie. We're very, very fortunate to have her in that role. We do still have open positions at Biomonitoring, so anyone interested in joining the team, please get in touch with us. The other programmatic update I have is that the 7th legislative report, which covers July 2019 to June 2021, is now available. This is posted on our website. This is a biannual report that we're required to put together that reports out on activities and data that's been generated during that 2-year reporting window. And we're at work on the 8th legislative report. So let me turn to some project updates. And as I go through this, you'll note that we have a lot of external collaborations in the works now. And I'm pointing this out because I think it was a year ago we were talking about how to make the program as impactful as possible. So one of the recommendations was for us to reach out and form more partnerships. And I think we've done a lot of that this last year, and it's been a very effective approach. So I'm starting off with the California Regional Exposure or CARE study. This is our surveillance work that was conducted in Southern and Southeastern California with samples collected from 2018 to 2020. And we're currently using that data to better understand sources of PFAS exposure. So Toki Philman from our staff has been focused on this association between drinking water levels and the serum levels in those care participants. I'm working to identify a single drinking water source for each of those participants, which is complicated because there's a lot of mixing, there's a lot of switching off of wells, and that might vary by time or by season. So Toki's been working with the water board to validate water boundaries. And initially we had 42% of participants who were assigned to multiple sources, but with her effort, we've gotten all but 4% assigned to a single jurisdiction now. The second part is to assign a PFAS level for each of those water systems. So Toki's been looking at data that's been submitted in response to water board orders between 2019 and 2022. And the team's been collecting data from consumer confidence reports. So at this point, we have 75 water systems that have both a care participant living in it and PFAS testing data from the water board's investigative orders. And 62% of those water systems have at least one PFAS detection. So the next step will be to look at the associations between drinking water data and the CARE serum results. And while this has all been going on, Toki's also been working with the water board to think about how the new water board orders coming up and the upcoming EPA maximum contaminant levels will impact water quality as well as availability of data. She's also met with the Cal EnviroScreen staff to talk about how to best incorporate the PFAS data into their mapping tool. And Toki and Kathleen have been working with Boston University School of Public Health, Emily Penoyer, Tom Webster, and Wendy Heiger-Bernays to look at the relationship between dietary factors, drinking water, and the PFAS levels in our participants. Moving on to ACE, this is the Asian Pacific Islander Community Exposures Project. This is a study that focused on Chinese and Vietnamese communities in San Francisco and San Jose. Samples were collected in 2016 and 2017, and we biomonitored folks for metals and PFASs. We returned those results, and we've reported on summaries of those results in this forum. And we're now getting back to some of the exposure work. We have also compared the ACE findings to the risk-based categories that were proposed by the National Academies of Sciences, Engineering, and Medicine in their 2022 guidance on PFAS exposure, testing, and clinical follow-up. And as shown, we have a disproportionate proportion of a percentage of ACE participants that fall into this category of increased risk of adverse health effects. That's compared with a more general population of the CARE study. You see that many more of the ACE participants are falling into that higher risk category. So clearly a concern and a priority for us to identify exposure sources for PFAS in this population. So Kelly Chen, also from our staff, is currently working with our exposure data to better understand the dietary sources of PFAS exposure. She's been focused on fish consumption habits. We do have very detailed dietary information, which we collected in our exposure questionnaire. The questionnaire was not solely PFAS, there were also questions related to metals, but there were a number of questions related to fish consumption that Kelly is delving into. So ACE participants reported eating much more fish, more frequently than NHANES participants. They reported a total of 47 different fish species that they purchased, 14 species that they might be catching themselves or their friends and family catching, as well as 10 shellfish species that were consumed. We did incorporate a question about what part of the fish you eat for the ACE2, the second part of the study, and 84% of the participants reported eating non-fillet parts of the fish. We don't have a lot of data on PFAS levels in non-fillet parts of fish, but estimates in the literature suggest that the non-fillet parts may be 2 to 10 times higher in PFAS than fillet. So these variation in how much fish you're eating and what parts of the fish you're eating are really important because the advisories are often based on and provide guidance in terms of fillet. So the next steps that Kelly's working on are to identify potential associations with the PFAS serum levels based on how participants answered questions about fish consumption. So for example, are there differences in PFAS levels between the participants who ate self-caught fish versus purchased fish? Are there differences in PFAS levels based on what part of the fish you're eating, whether it's the fillet or the non-fillet parts like the head, eyes, and skin? And are there differences based on the habitat of the fish? Fish levels are related to where they spend their time, and so categorizing fish by freshwater, marine, or migratory environments is a reasonable approach. Kelly's also been looking at the fish consumption advisories. 16 states already have a PFAS-related advisory, generally focused on PFAS. And there are many states, including California, that are monitoring PFASs and considering guidance. So Kelly has been connecting with many different groups. So we have Fish, Ecotoxicology, and Water Section, the Water Board's Surface Water Ambient Monitoring Program, US EPA, San Francisco Estuary Institute, and other researchers who are concerned with this question of safer fish consumption. We're sharing the data that we've collected in ACE and hope that the data collected will result in better understanding of how fish is playing a role in PFAS exposures. We're also hoping that we can feed information back to the communities, not just the ACE population, but all communities that rely heavily on fish for nutrition and eat different parts of the fish. So really good work from Toki and Kelly on this project. They are both going to be presented at the National Biomonitoring Conference in January. For our most recent surveillance effort, we're working on the studying trends in exposure in prenatal samples, that's STEPS. And we've been working on this to estimate population estimates of PFAS exposure and also time trends among pregnant Californians. So in designing the study, we've put a lot of effort into thinking what are those time points we want to capture and what counties. And since our last update, we have selected Orange County and Fresno counties as the 2 places of focus. Orange County, we've had evidence of elevated PFAS levels in drinking water from sampling that was collected in 2013 to 2015. Since that time, there have been wells taken offline, there have been some filtration put into place. So it's an opportunity for us to measure the impact that interventions in water quality will have on serum levels. In Fresno, we have relatively little information, both biological and in drinking water. So this data will be a contribution to understanding the PFAS levels in Fresno. The eligibility criteria are nulliparous individuals and healthy singleton pregnancies. So among the available samples we have, we're conducting some random sampling. We actually have, we had a goal of obtaining 500 samples per county evenly spread across those time points, 2015, 2018, and 2021. We oversampled because you never know what's going to happen with your sampling, and we have a little bit over 500 samples per county. The samples are in our freezers. We're able to obtain those in June, and DTSC is going to start conducting the PFAS analysis using the expanded panel that you'll hear about in just a few minutes. We're still working to establish a prospective sampling from a non-biobank county, if that's still a possibility. And we're working on evaluating some collaborations to really magnify and maximize the impact, what we can learn from steps. So we're looking at some additional chemicals and biomarkers that we might be able to measure. We're thinking about potential PFAS exposure sources that we could identify, like drinking water, and also how could we evaluate associations with health outcomes. On the lab side of the program, the environmental health lab has been adding to our available methods. We now have a urinary nickel method. VOC metabolites and an updated PAH method are going through some final steps of validation, and all three of those new methods will be available to our studies in the coming year. We currently do run VOC metabolites through a private lab, but we're really hoping to bring this work in line shortly. And work is also continuing on the mercury speciation method. So the lab is currently receiving and aliquoting samples from Biosphere and Fresca Mujeres, and work has also started on the CARE-LA samples. If you remember, we did a subset of those participants. We biomonitored them for phenols and speciated arsenic, but we'd really like to be able to generate population estimates for both of those panels. So EHL is completing analyses on all CARE-LA participants at this point. In the environmental chemistry lab, they have completed the intra-program pilot study analysis of PFAS in serum and plasma, which Songmei is going to talk about shortly. They do have the 1,000+ samples for the STEP study that they're about to embark on, and they are continuing to work to extend the panels that our program can measure. So they're working on a PAH method in serum, as well as siloxanes in serum, and there's some initial stage of development for a total fluorine method, first for use in products and environmental media, but eventually we hope to have this available for biomonitoring. And getting the word out on all of our projects is the Outreach and Communications Group, and they've been focused on producing fact sheets and other material for different audiences. The two fact sheets shown here are nearing completion. One is focused on arsenic and rice, which I think we talked a little bit about last time. It's currently in a testing phase, working with key informant interviews and focus groups to ensure that the language is accessible and understandable. And the other is focused on our study of how flame retardant levels change with foam replacement in your home. And that's also in development. It will be a companion piece for a scientific publication on the freeze study. The CARE study report, which has details on study methods as well as our results, has just been approved for distribution. This is the first time our program has put together such a comprehensive report like this on a study. It will undergo remediation and some translation, and then we'll be releasing the report and also holding a public meeting to present those results in early 2024. We do already have a 2-page graphic summary of findings, both in English and Spanish, and that's already posted on our website. The outreach group also tracks legislations that might impact or be impacted by our work. AB 496, cosmetic safety legislation, has just been signed into law, and it's going to prohibit the distribution of personal care products that contain certain ingredients. There are 12 ingredients that are on the list for 2025, and an additional 26 ingredients that will be banned starting in 2027. So some of the ingredients, mercury, parabens, phthalates, and some PFASs, which are on the list, are things that we have historically measured. We don't currently have surveillance projects that measure any of these chemicals with the exception of PFASs, but we're always looking for opportunities to monitor changes in exposure in the population as legislation is enacted. And finally, the outreach group has been completing a series of interviews, soliciting feedback on the impact of the program. How's our data being used? Are our fact sheets or questionnaires or other materials we put together, are they being accessed and used? And are there things that the program should be taking a look at? We've just completed 15 years as a program with Biomonitoring California. So in part of observing this mark in time, we did want to get feedback from collaborators, advocates, and other partners on their thoughts about the program. So some of the findings from these interviews will be included in the 8th legislative report, which is what we're working on now. Results may be presented in this forum or as part of a 15-year celebration for the program. But ultimately, I think the results will also trigger discussion both within the program and with our partners about how we move forward for the next 15 years. And with that, we'll turn it back to McKenna. The microphone is, so may just pay attention, the microphone is kind of sliding around. Make sure you can speak into it.
I'm going to take a moment to introduce our next speaker. I think we have questions after these two presentations. Yes, I know. We're going to hold them for just a minute. Okay, Songmei is a research scientist 3 at the Environmental Chemistry Laboratory at the Department of Toxic Substances Control, focusing on PFAS analysis in biomatrices. She will give an update on the methods for analyzing an extended number of PFAS in human serum and plasma.
Okay. What is page? Okay, good morning, everyone. I'm Songmei from ECL Lab of DTSC. I'm so glad to have the opportunity to introduce our work about the extended list PFAS analysis. So here's the outline of my presentation. So after I introduce the background of method development and how we developed the method, I will discuss its application to IPP7 study. So it's kind of the last step of method validation. So we also have a recommendation for a future study based on the IPP7 data. So PFAS are a large group of chemicals. I list some PFAS on the right side. We can see, although all they have at least one carbon fluorine bond, their structure can be very different. So there are thousands of PFAS in the world. Previous biomonitoring methods are available only for a few of them. Typically, just the most persistent legacy compounds such as PFAS. So driven by the regulation, longer chain PFAS were phased out. So more emerging compounds are used, such as the short chain PFAS and some polymer and the ether acids, etc. So GenX, Adona, and the F53B are the key emerging replacement. But because lack of the analytical methods, so there are not enough knowledge about this human exposure to this replacement. So besides that, all previous methods apply only to serum sample analysis. So right now there are more demands for plasma sample analysis because the clients only have a plasma sample in their biobank. So therefore, the objective of our study is to establish a sensitivity method. We can include more replacement PFAS and can be used for human serum and plasma sample analysis. Here's the history of the method development for PFAS in ECL Lab. So in 2009, ECL Lab established the first method to detect 12 legacy compound. At that time, we called the perfluorinated compound PFC method. So later on, our lab developed another method in 2016. So this method was expanded to 32 compounds, include some polymer acids. Last year, we developed the current method using a new generation instrument, CC500 system. So beyond the 5500
method, we add another 19 more emerging PFAS to investigate. So they include the short chain PFAS and Gene X Adona at 53B. The total we investigate 51 compounds. Here's the challenge of the method development. As we introduced before, PFAS have a diversity structure. So their physical and chemical properties are very different. So it's very difficult to analyze all the compounds in one condition. Or even for the PFAS with same functional group, short chain and longer chain show different retention in the SP cartridge and the analytical column. So we screen 3 different SPE extraction solvents, the DVB, C8, and the phenol cartridge. So C8 works best. In regarding to the PFAS with different functional groups, the difference among them are more obvious. So they have the different optimized mass spectrometry conditions and the source temperatures. So for each sample, we include the quantitation signal, qualification signal, and the internal standard signal. So we total need to monitor 136 detection channel for each sample. So we have to compromise the experience condition, make all these channels work together. So besides that, for the mass spectrometry detection, the more signal in into the method, and the less sensitivity of it. So it's more challenge. So second challenge is the matrix effect. Significant matrix effect was observed for some compounds. So their signal can be 10 times lower because of the matrix effect. Labeled internal standard can be helpful for compromise this matrix effect. We only have the labeled internal standard 29. Sometimes the labeled internal standard cannot work all the time. So we can do further cleaning by using the SPE extraction and the LC separation. So another headache for the method is the background issue. So PFAS are everywhere compounded. So we can generally detect the background peak or some interferences peak. So we have to wash the system periodically and thoroughly. And also we need to screen the high quality solvent. We have to use the LC mass grade solvent. So last limitation is the limited time and the results, including staff. So we have sample for timeline for sample analysis. So even we want to improve the method more, but we don't have time. So the method is not perfect, but it's the best for us. So here's the method. So the sample preparation is very simple. Just mix 100 microliter sample with the internal standard and the formic acid and put them to a system for analysis. We use the C8 cartridge for extraction and for UHPLC for separation. The analytical method dropped the time from 30 to 12 minutes per sample, comparing to previous methods. So less solution used make this method more greener. So the calibration curve is prepared from 0.1 nacogram per mil to 10 nacogram per mil in Biomonitoring serum. So the method was validated. We have in-house QC in Biomonitoring serum at 3 levels. And also we have in-house QC in human plasma at 2 levels. We also have this NEST SRM 1958 as a QC. So generally the accuracy and precision criteria was set at 30%. All compounds generally can be in 20%. And the linearity R square. So we set up like a larger than 0.95. Most of our compounds can be larger than 0.99. And And also we tested the stability of this compound. So after the sample stored in freezer at -20, most of the compounds are stable more than 1 year, but these two parts have the trouble. So we need to do a further investigation. So in addition to this QC evaluation, we also attended the international performance test. So they include 9 PFAS compounds. So we attended last year and this year, all score were within 1. So we're very satisfied our results. So here is IPv7 data. So IPv7 will collect the 36 paired human serum and plasma samples. The purpose of this study is getting information of human exposure to the replacement PFAS. And also we want to get some information about the relationship of PFAS concentration in plasma and the serum. So at this time, we still monitor 51 compounds, but we successfully report 42 compounds. So among these 42 compounds, 20 compounds were detected, and 13 compounds detection frequency are more than 30%. So overall, the serum sample and plasma sample have similar detection frequency. So in the figure, I list the legacy compounds on the left side. We'll see they still have a high detection frequency. For the GeneX Adona, we didn't detect any signal. F53B, we detect around 40% detection frequency. See, we also see the little box, the 4 new PFAS is a PFPES, PFHPS, and PFECHS. F53B major were detected for the first time by monitoring California with a detection frequency 39% to 100%. Here, these 3 compounds, PFHPA, F3, FTCA, A2, FTS, they have lower MDL than previous study. Right now, the MDL is 0.01 nanogram per mil, and before they just lowered the MDL 5 times than before. So the detection frequency for these 3 compounds are also higher than previous ACE study. So here's the compound. It's a PFBS, carbon-4 PFAS. They keep the same MDL, but it is increasing in detection frequency. So this showing industry moving to the short-term PFAS. Here the plot, we compare the medium and the range of PFAS concentration in serum and plasma. So only the PFAS with detection frequency are larger than 30% are plotted. We can see legacy compound P4, PFHXS, and the PFAS still have the highest concentration among those compounds. Although the 4 new reported PFAS have the high detection frequency, but their concentration are still pretty low. And also the plasma concentration range, we can see is similar to the serum concentration range. Here's the plot to show the example. Their serum and the plasma concentration relationship for this compound. So the right line is a 1-to-1 line. PFAS, P4 and the PFAS sample distribute just along the line. So their serum and plasma concentration matched pretty well. For the F53B sample, so a little bit away from the ML1 line. So F53B plasma matrix a little bit higher than the serum. So generally the plasma concentration matched with the serum concentration very well. But for some compound, we still observe some significant matrix effect. So in this slides, we want to get a discussion So we list our recommendation for future study. Due to the limited resource, we must work efficient. So the IPP7 study provides some information to answer the trade-off questions. Yes, do we want to know information for more samples, or we want to monitor more compounds? So although there may be no signal what observed right now. So now we recommended the list based on the QC criteria, detection frequency, and the sensitivity of the signal, and also the matrix effect. Although some key replacement such as gene X or donor and some short chain PFAS, they are not detected now, but we still keep monitoring them. So this we recommended 32 compounds, and also we noticed that in 2016 the ACE project have the 32 compounds, but this different. The blue hat PFAS in ACE we dropped because they are we didn't detect any signal for them, but we add this red underline PFAS for future studies. Here's the bring home message. So our new method can be expanded to monitoring this from 12 legacy compound to 42 PFAS, include some important replacement PFAS. This method was less solvent, and this method can be used for serum and plasma analysis. So this method also is less solvent consuming, so faster and more sensitive for some compounds. So in this paired study, this 20 compounds were detected. Among them, 13 compounds with detection frequency more than 30%. So we also recommended 32 compounds for monitoring later, and we promise we will keep optimize or improve this method. So here's, I want to show my thanks to the fund support from the Biomonitoring California and the UCSF Earth program, and also appreciate all the IPP7 participants and all the people help me and discuss with me and help me to present here. Thank you.
We have 10 minutes for clarifying questions from both the panel and the audience, and then we have a discussion, 30-minute discussion section. So this is just for clarifying questions.
So this really goes to the first presentation, Nerissa, and it's just a clarification. So in the CARE program, which is very water focused, and then the ACE program, which is again on a specific population, you were talking about the efforts in the ACE program to do questionnaires to really try to pull out a lot of information about the different exposure pathways or sources. And I was just wondering, in the CARE program, is there a questionnaire or some way to, figure out, do people use dental floss with PFAS? Or are they sports players on synthetic turf? And I mean, is there some way? So I mean, it would give you a little more ability to see confounding kinds of exposures that wouldn't be linked to drinking water. I was just curious if there's some effort.
There is. So for the regional exposure study, there was a questionnaire, but it was not as in-depth or as extensive as the ACE questionnaire. So it did touch on diet, and Boston University collaborators led by Emily Penoyer are looking at dietary factors in conjunction with drinking water and the PFAS levels. And we are looking at other exposure factors for some of the other things we measured in the CARE study, but we don't have the ability to do the same kind of in-depth analysis of fish consumption. There's only so many questions you can ask on a questionnaire, and CARE wasn't, we went into ACE knowing that there's certain dietary factors that we were particularly interested in, and so that questionnaire was particularly focused on it. So there are different questions we can interrogate from those different data sets, but CARE we will be using the exposure information for CARE.
Ulrika.
Thank you for all those presentations. So I think let's see, I have a couple of questions, and I think this is for regarding the measurement of PAHs that you mentioned in serum. And I was wondering whether you would be able to measure some of the PAHs that can't be biomonitored in urine because they are excreted into the feces via the bile.
I think that's really a question for Jun Su. Jun Su, there's a question about pHs in serum and the different pHs that you might be able to pick up in that method.
Yes, so we don't want to overlap with the urinary pH analysis, but we had an expert joined our group from the UCLA. So she measured air samples, 137 PAHs. Also, she was interested in the non-targeted PAHs in the blood. So basically, what we're trying to do is what else PAHs the people got exposed in the Californian population. So that's what our aims. Yep.
Yeah, I was particularly curious about some of the high molecular weight pHs that you don't. Yes, right. Okay.
Exactly.
Okay, thank you. And then there was another question related to the PFAS in fish and whether you have any information about like the fat content of the fish and whether that affects the PFAS levels in the fish. The biomonitoring results.
Well, that's an interesting question. I don't know if Kelly Chen is probably online if she wants to raise her hand and say something about this. At this point, I don't think we have looked at fat content of the fish. Kelly, do you have something to add?
Hi there, this is Kelly. We haven't looked into that, but that's a great question. I know that PFAS doesn't bioaccumulate in fat tissue similar to other chemicals, but I can look more into that.
But part of that questionnaire does ask about the frequency of different types of fish that they consume. So we are able to maybe segment out the different types of fish by different protein to fat ratios. So it's an interesting point. Thank you.
Other clarifying questions from the panel? Yes, Jenny.
Hi, Jenny Quintana. I had a couple clarifying questions, I guess, for Nerissa at first. One was that you talk about looking at eating non-fillet fish parts for the PFAS, but can you just remind me if you did that for mercury as well? Previously looked at mercury levels in blood related to the non-fillet fish parts, because I know there's some literature about that, and I was curious, and I'm sorry if you already reported it and I don't recall.
No, actually, we had looked at, I believe we had looked at fish consumption, just frequency of fish consumption and mercury, and then just the comparison of people who had met a level of concern in the ACE population compared to the general population. But one of the things that our new staff is enabling us to do is to go back and look in more detail at some of these exposure issues. So that's a good point to get back to the mercury issue with fish parts.
Great. And then you mentioned the STEPS study. And again, I apologize. I think you probably presented this before, but can you just explain the selection criteria and rationale again?
The selection of the counties
Of the subjects, I think it was nulliparous and the healthy singleton.
Yes, so nulliparous in part because previous childbirth or breastfeeding will have a lot of will impact your PFAS levels, and so we stuck with nulliparous so that there had been no other live birth or breastfeeding in the past, just to sort of make our population a little bit more uniform. Singleton pregnancies, there's some concern that like blood volume might also impact your PFAS level. So if you have a multiple pregnancy, that might be another impact. And healthy pregnancies, just again, to try to make our population as uniform as possible. So we don't have other confounding, other impacts on PFAS levels that we can't take into account.
So the selection criteria is either nulliparis or singleton, or are you trying to balance the
Okay.
two, or?
Both.
Yeah.
So it has to be all three of those things, a nulliparis,
I
healthy
see.
singleton pregnancy.
I see. So the first pregnancy, so all these people
Yes.
are, okay.
Yes.
So and you take them at a certain point in the pregnancy. Is it 14 weeks or 16 weeks? I forget.
It's anytime during the second trimester. So this is using the biobank samples that are collected by the genetic disease screening program. So their second trimester is between 14 weeks, 0 days and 20 weeks, 0 days, I believe. So anytime during that point, a woman will come in for her second trimester screening, and those are the samples that are available to us through biobank.
And can you remind me, it's serum, correct? Not
It's
plasma?
serum, that's right.
Okay. So I thought about that for the last presentation. I have more questions, but I'll wait for others first.
I just want to check about online questions.
We have a question from Jean Wen. Jean Wen, do you want to unmute yourself?
Yes, good morning, everyone. And I like to I have a comment with Songmei's presentation, and congratulations, ECS laboratory increase the capability and to cover almost more than 40 analytes for PFAS in last few years. My comment is, I think you mentioned your method suffering matrix effect, which is a good finding. To improve it, so we need to verify it's really from a matrix effect or from your spike standard be lost. So I think your discovery is through the comparison of the response of the standard spike into solvent, and then how much standard recovery with in your samples. With this comparison alone, we cannot verify that's a matrix effect. So my question is, did you do a post-sample preparation standard addition to verify this loss of the response is from either your C8 column lost the analytes or is a matrix effect?
And Jim, so the question is this online extraction method? So it's not an offline SPE method. So it's not.
You cannot do a post sample preparation addition to verify. Is that what you said?
Yeah, it's a different from normal SPE or manual SPE.
Sorry, I understand that part. I think that after online preparation, if you move that wire out to do a post sample preparation addition, you may can distinguish which is your CAT lost it or the matrix effect, because regardless of the online or offline, the test procedure is the same. We might talk after that, unless someone like Junsu wanted to add something.
I think I think I have some data, but I didn't calculate that. So the reagent still pass the online SPE procedure. So this I think this is a matrix effect.
Okay, thank you very much. Thank you.
Other questions? Yeah, Oliver, and then we'll come back to Jen.
Yes, I wanted to stay with the second presentation on the analytics. I've seen that you use 100 microliters plasma or serum, and you inject 50 microliters later on of a resuspended solvent, I guess, or your overall injection was 50 microliters after. I had wondered what happened to the plasma lipids. So when you use solid phase extraction, you extract very lipophilic compounds. That includes PFAS, but it also includes triacylglycerides and all sorts of lipids that are very abundant in plasma. So I'm a little worried that you do not appear, or I understand that you inject them together, the lipids and the PFAS together, instead of using a cartridge that are available on the market that specifically removes lipids. Such cartridges have been published in EHSP, and wonder if you have tried them or thought about these fatty acid removal kits.
No, so this method is still the online extraction. So we do the online SPE extraction. So it's cleaning a little bit, but also we can try separate them from the LC separation. So I know sometimes they still have the trouble. So that's why I reported some, matrix effect, but we still can improve. Yeah, this one we use the online extraction because there are less manual involved, probably less contamination. Yeah.
Jen?
This question is for Nerissa again. I remember the second half of my question about the STEP study.
And if I could just correct my prior answer, it's 15 weeks, 0 days to 20 weeks, 0 days is the second trimester for GDSP sampling. Sorry, I
thank you.
misspoke earlier.
I guess my question was excluding subjects without health, your criteria is a healthy pregnancy and then a healthy baby. So you're determining that, is that right? Or just a healthy pregnancy?
It's
Or-
well, healthy pregnancy as defined in the GDSP world. So it's a pregnancy without a screen positive
I
for
see.
one of the things they're screening for.
I see, okay. I wasn't sure exactly what that meant. I make sure you weren't excluding certain populations. And I'm just curious about age. It seems like these chemicals are going to be more and more age dependent as they enter the food chain and bioaccumulate and stuff. And I'm just curious if you have also an age range criteria, because if you don't, you might be biasing towards certain populations or what have you. So I was just curious about that.
Sure. Well, they're pregnant individuals, so there is some age bracketing just by that. And I think we did apply age bracketing. Dina, do you want to answer this question? Well, there were certain other criteria just for kind of bracketing our population a little bit. And
Dina DeBraca, California Department of Public Health employee and Biomonitoring California staff. So for steps, just to explain healthy pregnancies, we do not have access to, they're called registry traces. When they screen positive, those are saved for individuals who are asking specific research questions to understand the etiology of the disease. So that's why that criteria is there. And then we use the California birth record for the year as our sampling frame for this study. And within the counties that we selected, we excluded pregnant individuals under the age of 15 and pregnant individuals over the age of 45. And in those counties, those are very few exclusions. But we did band the age range to that age range. We also excluded people who are missing age, just to sort of get around data entry issues or missing data. So there's a little bit more eligibility criteria than was listed in the slide, just to make sure we had complete data on the individuals who were selected. If we're done with clarifying questions, including from online, Stephanie? Yeah, okay, then we get to move into our discussion section. And this can be input from the panel and also from audience or online attendees about the program updates that were just presented. You don't want to start us off? Tom, go ahead. You're gonna pass that.
Just this, I thought it'd be useful to start addressing the question about how, the question with PFAS compounds, with the ability to sample so many. The question came up about, so do we do more samples or more compounds? I mean, do all the compounds on fewer samples, because you can't really do both. And I thought it's interesting to consider if it's possible to sort of, and I think it's already happening, this sort of staging to do a first set of samples, which is not a lot, but look for every compound, and then screen out the ones that really aren't showing up. And then once that set is developed, then do more people, right? And fewer PFAS compounds. If you could exclude the ones that like are below 10% detection, it's probably not worth it to go out and do a large number of people for every compound and exclude those. Again, I think this came up, but I actually think that's a good idea to try and do that staging. And it might be a useful, cost-effective way to get a lot of information.
I had a similar kind of thought, and maybe we could turn it to program staff actually as a question of like, is that a reasonable response to the question? Like, does that get at the resource constraint that you're talking about? Or do we really have to make a choice between number of samples and number of analytes? Like I would choose range of analytes, but this hybrid approach sounds really useful to me if it still accomplishes that streamlining function that you're asking about.
We'll have Songmei and Junsu get into the details of this, but that is essentially what we're doing with the steps. Where, as Songmei described, there are many more compounds that they could identify, but the time to verify all the peaks of ones that are very, very low detection frequency is very laborious. And so we're going with a list of 42. We are going to keep an eye on the ones that we are not reporting out for those to see if things are coming up. I mean, we do want to make sure that we're both tracking the time trends of the existing ones, but also looking forward to new things that might be coming up. So it is that balancing act, but that was our strategy going forward for steps. Songmei or Junsu, if you want to
add something, because I think this we have to monitor 126 channel or signal for one sample. So if we look at the data, this is the bottleneck of the study. So we take a long time for the data review. So sample analysis acquisition is very quick. Probably one day we can finish, but we take probably so weeks to look at the data and summarize that. Yeah.
This is Junsu. If I may also add to what Songmei just explained, it's kind of picking the compound, the PFAS compound, very low level. It's not if we add 10 more compound, it's not like you times 2 or something like that. It takes 3 times, 4 times more because you have to differentiate from your noise levels. So that's why we have to come up with the first phase this much and the second phase more. Yeah, that's why Jinan, Dr. Shaw asked a very valid question, also same as Dr. Finn, because we're using the pretty much neutral SPE cartridges, so not enough to get rid of all the polar compound like fatty acid. So it will come together, but that's what we got. So, but Songmei already developed the method using the 3 more analytical columns. If she used the 2 separate injection, one she just presented the other one is also called the phenolic column. She can add 6 more, right? So, but we have to come up with the practical way to work between resource and the kind of outcomes. So that's what I like to stress out. What Songmei said. Also, the one more thing to add, I forgot important thing. Dr. Amber Kramer, our new biomonitoring the scholar, she's she's interested in particularly the more carcinogenic PAH, high molecular one, also the metabolites. Also, she's very interested in the markers of wildfire, which the California has a huge issue. Yes, thank you.
Just to wrap that point up, I guess I would just register that I fully support, and I think is what Tom's saying too, that emphasis on casting a wide net, because it's one of the great services sort of that biomonitoring serves, is detecting compounds that we may not know are increasing in prevalence and use. Oliver and then Jose.
Yeah, starting. Sorry. Starting with that.
How about Jose, and then we'll come back.
Jose Suarez, I have a question with regards to, I have a question with regards to some of the newer PFAS that you can measure now that are detectable in a good amount of participants, but at very low concentrations, which was a good amount of them, I think. So my question is, how much do we know about some of these that you're measuring now, the prevalence of these in vacuum container tubes and cryovials as potential sources, which are not real sources of exposures?
Yeah, sure. That's why we always try to stick to the cryobio we tested in the past. Sometimes it's not always like that. Without our involvement, the samples are collected from the the biobank. That's why in that case we try to also test cryobiots they used. Make sure that there is no background levels coming out, leaching out from the containers. Yeah, that's we do our best to minimize all the background interference. Yeah, thank you. Yeah.
So I have two related questions. One is about the internal standards. If I understood correctly, you only have one internal standard, and that is of course not much to have analysis of very polar and very non-polar PFAS and PFOS. So the question is, are there additional initiatives to, maybe with industry, with chemical industry, to get more surrogate standards established? Second, I would very much advocate that any analyses that are done would contain community standards like NIST SRM 1950 as another control to make sure that in the future we can relay back. So if we are missing standards now, or we want to advance our methods, we would know what we have missed in the past. So that's on the analytical side. On the data analysis side, I had wondered a little bit similar to the questions before. Can we use the classic high abundant PFAS as a canary in the coal mine to get the idea of total PFAS in a specific subject? Or is it so that the new PFAS, you mentioned those that are coming from industry, are unrelated, so you're not correlated to the classic ones? So that's why we would need to really have as many as possible to detect those, because maybe sources might be different. So these are two different but related questions, I guess.
Okay. Yeah, Dr. Lin, thank you again. There is, I think, some misunderstanding. To my understanding, we have many internal standards as possible. So this is Songmei's method, the new method. We use almost the equivalent to the isotope dilution method, which is still gold standard in the analytical chemistry. So that's the first question. The second question is kind of lump sum all together. That's kind of very controversial all the time. That's why I think Nerissa, Dr. Wu, did you give some, the verbiage of your slide? Yeah. So basically, that's the way we like to screen first. Right now we have a combustion ion chromatography instrument can measure total fluorine. So what also we both purchased that instrument to support our safer consumer product team. So cooperative work, the initiatives, for PFAS, and right now we are very close to the screening or the treatment spray from the Scotch Guard, whatever the commercially available treatment spray for your textile or cooperative works. That's where we are right now. Next method we want to develop is the food packaging. So it's a we getting there to measure, to get some idea what kind of a total fluorine level we expecting. Once we got that, we have a significant enough levels. We try to move to the comprehensive analysis, looking at the individuals. We're not gonna stop that. We also the screen by the non-target analysis because we do have some important PFS database right now. The Dr. Miyama has about 650. If it's not enough, we're going to screen by the US EPA CAN dashboard. They have, to my recollection, they have 12,000 PFS based on their definition. So that's where we are right now. Yep.
Hello, Kathleen Atfield, Biomonitoring California, CDPH. In answer to your question about PFAS profiles, we're very interested in looking at profiles in different populations over time. But I don't think we can use the legacy compounds as sort of canaries in the coal mine, though that would be great because of the shift in PFAS manufacturing, both in the United States and abroad, that there's just different different profiles of PFAS use in products. But and especially with the long half-life of the earlier PFAS, we see those declining in our populations here in the United States and in California. But we are concerned about the other ones beginning to accumulate more, being showing up in different ways.
I have a question for Nerissa about the response to the cosmetic safety legislation, AB 496, and I'm just thrilled to hear. I know this is something that we've talked about a lot as a panel, and the program is very interested in trying to track impact of new policy. And I was hoping you could expand on that just a little bit to tell us what you're considering and where you have baseline data. As someone who has tried to use biomonitoring data to look at the impact of policy, there's that real bind of comparing 2 points in time when the data were gathered for different purposes and in different ways. And I'm just curious what the prospects are for looking at that.
Well, I did hesitate about putting that slide up there because I knew it would spark an optimism, which we don't have a plan right now. We only have Serum for our surveillance currently. We are considering other potential sources of surveillance samples, but this is far down the road. But yeah, a lot of the things we're interested in tracking are urinary metabolites, and we can't do that through our current STEPS project. So it's all, we're always looking for opportunities if there's something we can, another study that we can join into so that we can get access to those samples. We have the lab methods and the will to do it. We just don't have the project set up right now. So totally open to hearing some possible collaborations we might be able to form.
And the project, what you're talking about is needing baseline levels for the equivalent chemicals that you want to monitor in the future, post-legislative implementation.
Right. I mean, if it's surveillance, we really want to think about what population we're gathering samples from and in what way, because it's, convenient samples are useful for some things, but if you're really looking for time trends, we would want to have a pretty broad general population sampling. So that's harder to come by. But yeah, for phthalates, parabens, and it would be urinary mercury that we'd be interested in. We'd really need to have urine.
And CARE doesn't give you what you.
Well, we do have urine from, we have samples from CARE from 2018 and 2020, and we're hoping to have this population basis for phenols levels for CARE-LA. So that could be used as a baseline. It's not a true population survey, but it's pretty close. And so we could use that as a comparison, but there are lots of other things changing over time. And so if we were really going to do temporal trends with those, we would want to have a robust surveillance methodology looking year after year as these legislations go into effect.
Is there any possibility of returning to those CARE participants?
We did not write that into our IRB. I think we do have the potential to talk about study information in general. So if we wanted to talk about other work biomonitoring is doing, we could broadcast that out to all participants, but no, we don't have permission, given our current consent, to go back for additional study work.
Or to go back and request new samples. That would have to be a new.
Right.
Got it. Thank you. That's really helpful. It's an exciting opportunity. Jenny.
Hi, Jenny Quintana. I want to echo how important it is to document the positive effect of policies. It's such a powerful tool and support for passing these kind of policies. Like you said, it'd be very helpful and useful outcome of California biomonitoring. I mean, everyone's seen that graph of children's blood lead dropping after they banned leaded gasoline and then leaded paint. You know, it's a very powerful graphic. It just, you know, get the lead out of gas and, you know, it goes down in the kid's blood. And so I think I talked about it before, trying to do that for diesel, you know, markers of carcinogens in diesel will be very powerful as we went to clean diesel to get that kind of documentation. Again, that's urine, like you said. But it also made me think it's also very important to look at disparities. So when the flame retardants were, certain ones were banned, you know, I think it was Amizota that had the paper showing that it was lower income participants that remained exposed to these more legacy compounds in older furniture and homes and stuff like that. And people did not have the advantage of the new compounds as quickly as persons that were not disadvantaged. And so I think it's also useful. I don't know if what data you have on any indicators of being disadvantaged, but I think it's important to continue to document disparities as well, if you can.
One other thought that I have, and I'm sure you all have thought through this also, so forgive me if I'm just mentioning things that you've already talked about internally, but is, you know, I know that when you do a study in any particular population in California, you often also compare it to NHANES biomonitoring levels. And I'm just wondering if there's a potential to use that comparison to be able to use NHANES biomonitoring data in the past as baseline and make some extrapolations based on the relationships you've seen between California levels and NHANES levels for particular substances in isolated studies. It would require a lot of caveats for samples taken under different circumstances and things like that. But I'm wondering about being able to draw on biomonitoring data. It's certainly something that we looked at, you know, in looking at the impact of Prop 65, is trying to dig out California data, which you can do with going to great lengths, working with the RDC. But in fact, because of the influence of California's economy, you know, we weren't sure that we were actually seeing big differences between California and the rest of the country because they change product lines for the whole country. They don't make separate product lines for California. So in that sense, you know, we sometimes can see things at the national level that we would expect, you know, that reflect California laws. Whereas looking at biomonitoring data on carcinogens associated with diesel, we do see the regional differences because the you know, either not because of the clean diesel necessarily, but because of emissions controls. Those really do only happen in California or in other states that have copied California's requirements. And so there you can actually see regional differences. But where it's product marketing, you know, like changing a product line or eliminating a toxic from a product, it's so much harder to see, you know, you're not necessarily going to pull out the regional differences because of how the products are changed. Yeah. Anyway, just a thought. We're at time. It's, I don't make an explicit call for public comment during this time. Has there anything come in, Stephanie?
Yes, Sean Wen still has his hand up. Sean Wen, did you want to quickly ask a question?
Yeah, this is still the same comment. I follow Dr. Oliver's concern about the method, but Jun Song, the Songmei is an expert. The questions ask how many standards, how many quality, how many NIST PT program or quality assessment program, which is really how many analytes include in that NIST we evaluated. I kind of express my concern is that because the program try to depend on which direction to move, it's very important. That's maybe also Sumin and Junsu mentioned that's only 10% recovery into the standard, which is the golden standard method. But when you have a absolute recovery so low that the golden standard method to compensate the loss or matrix effect doesn't function. So with that ones, I raise my concern, and then maybe just for program to consider which analytes we really for sure we know at least, which analytes we have only 10% of absolute recovery, regardless the matrix effect we lost. I think document this one is a very important step to move on, because I made a lot of scientific mistake in my life. I find a PBDF, I think the PBDF, I later on can verify that the PBDE. So I probably in a lot of popular site, but my bad experience when I think I find some new compound and teach me the lesson be conservative. Thank you.
Hi, Jim, this is Songmei. So I understand your concern. So I may now introduce the whole procedure clearly. So I talking about the challenges mean all the 51 compounds is now mean all the reported compounds. There are two longer chain perfluoro carboxylic acid that has a matrix effect, very bad at the beginning. So we start then the instruction cartridge from the DVB. So that's why we changed the C8. So C8, the matrix effect already got improved. So it's better than 10 times drop, but there's still half. Probably the recovery only have 50%. So they can pass the validation. So the validation we use the serum, Bowen serum. So they can pass the validation, but eventually we drop these two compounds in real sample analysis because they couldn't pass the human serum criteria.
Great. Thank you for that. We're going to break for 10 minutes. And let's return promptly at 10:38. So we have a 10-minute break now. We'll start right again.